Hi everyone, this is Laura Smith and I wanted to pop on because recently I received an email about oral apraxia versus verbal apraxia and what the differences were. So though I could make an entire talk on just terminology in general regarding childhood apraxia speech, specifically this talk today is just going to deal with childhood apraxia of speech and nonverbal oral apraxia. So let's start with oral apraxia. In a motor speech exam, when a speech language pathologist is looking to do a differential diagnosis for childhood apraxia speech, one of the things we're looking for is the presence of nonverbal oral apraxia. And what does that mean? Basically, to put it in real general terms, it's just the child might have difficulty with non-speech movements of the mouth. So can the child smile on demand? Can they pucker for a kiss? Can they do that back and forth and sequence those? And all of this would be in the absence of voice. We might ask them to stick out their tongue, move their tongue side to side. We're not testing for strength. We're not looking for that. Well, we might be looking for some weaknesses, but really what we're looking for is, can they sequence these non-speech oral motor movements? Can they produce? Can they copy non-speech oral motor movements? And if they cannot, it adds an even stronger case to the diagnostic profile that a child does indeed have childhood apraxia of speech and that their difficulties with speech production are due to motor planning. The reason that would be is because if we think of speech, and as you all know, whether you're a speech language pathologist watching this or a parent who has a child who struggles with motor planning, speech is the mother of all motor planning. And in fact, when you do have children who struggle to speak, it really makes you think, how on earth did any of us learn how to do this at all? And it comes so easily and so naturally to typical kids. But it is very difficult when you have a motor planning disorder. And so the act of speech involves, first of all, your breath, respiration system. So you need to be able to coordinate the breath and the exhalation. And that exhalation goes to the larynx where we phonate. Phonate is just a fancy word for turning on your voice and making those sounds here. And from phonation, we shape those sounds with our articulators. So our mouth, that includes our tongue, our lips, our jaw, our teeth, and we coordinate those movements then to produce the precise movements needed for all of those different speech sounds or phonemes. In oral apraxia, you're not dealing with the breath support, and you're not dealing, well, you might have some breath support if you're blowing, but for the most part, you're not dealing with your respiration, and you're not really having to think about phonation. Really, it just comes down to the articulators and moving the articulators in various positions. So it is almost a less complex task than speech. So if a child is having difficulty with doing this less complex task of smiling or puckering, and that is without having to then coordinate the breath support and the phonation, there's such a greater likelihood that the speech then, which does incorporate breath, phonation, and articulation, is caused by a motor planning disorder. So I just wanted to get that out there because I got an email where the child's SLP did diagnose him with pretty significant oral apraxia, but maintained that the cause of his speech production issues were not verbal apraxia. So I can tell you from a clinical perspective, just as someone specializing this, but also someone who follows the apraxia research pretty closely, I guess I can't say with 100% certainty that it would never happen, that you could have oral apraxia but then wouldn't have a co-occurring verbal apraxia, but it would be extremely rare. So that leads us to the question, can we diagnose CAS based just on oral apraxia? Because if a child has oral apraxia, well then they must have childhood apraxia of speech, right? That's a tricky slope, only because Dr. Edith Strand is the only one I could find online who's done a lot of talking about nonverbal oral apraxia and verbal apraxia together. And though she says in her 2018 article that the presence of oral nonverbal apraxia means there's a greater likelihood a child has CAS, we have to be careful because many kids with CAS, childhood apraxia speech, have normal oral praxis. So for that reason, it can't be used as a diagnostic criteria. And I would say that's true in my practice too. About a third of my kids have both, and the other 2/3 don't have any issues with oral apraxia. So that's the reason that we don't really have it as a definitive diagnostic criteria, because plenty of kids who don't have childhood apraxia of speech, many kids who do have childhood apraxia of speech don't necessarily have that oral apraxia component. However, if you are a person that sees oral apraxia in a child with these nonverbal movements and asking them to do these on-demand nonverbal movements, it really increases, it should put your red flags up for the fact that the difficulties with speech production are due to motor planning, aka childhood apraxia of speech. So hopefully that helped to clear up some questions people have regarding those two. If you have any further questions or comments, please leave them in the comments below this video and I'll be sure to respond to them. Thanks for listening. Have a good day.